As Paul said, we have online, or virtually, we have Elena Kountoura, who is the member of the European Parliament and formerly Minister of Tourism in Greece. Welcome. We have Cuthbert Ncube, Executive Chairman of the African Tourism Board as well. We have Taleb, who you all know here too. Elena, I think you're in Brussels, aren't you? The EU home, and the EU, I think, promised that it would be distributing vaccinations to the countries in Africa, for example. What's the situation at the moment?
Well, first of all, thank you for inviting me in such a very interesting panel and conversation. To be honest, the European Parliament, since last June, in an historical vote, asked from the Commission for a firm decision on waiving intellectual property rights for coronavirus-related products, including vaccines, at the World Trade Organization, aiming to address global production constraints and supply shortages. And in another resolution, last month, we called for more transparency in the development, purchase and distribution of COVID vaccines. I think the COVAX initiative is very important. The World Health Organization COVID-19 Technology Access Pool TAP, and the cross-border supply of materials needed for vaccine production, and as well its strategy for increased production capacity and criteria for dose distribution between countries. And at the same time, we called on the European Commission to provide strong safeguards for accessible and affordable COVID-19 vaccines when signing future contracts with pharmaceutical companies, considering clauses related to intellectual properties, rights, and non-exclusive license, prices, and best efforts to enhance production and distribution of vaccines. I have to say that the Commission, the European Commission, is late in everything, because you were talking before about percentage, and my numbers, they say that the World Health Organization said that in Africa, it's less than 5% of the population that is fully vaccinated. And also 4 days ago, this new ACT Accelerator Strategy Plan was announced and sets out urgent actions to address over the next year the gap in access to COVID-19 tests, treatments, vaccines, and personal protective equipment in low and middle income countries. So this is something that we are dealing as well in a European level, but the European Parliament always push and press the European Commission to work intensively in securing more vaccines for Africa, and also to reinforce dialogue with developing countries in order to gain the necessary knowledge on the challenges and difficulties these countries face in producing vaccines, and therefore to provide them with needed means and tools for vaccine production in their territory, because the truth is that the global efforts so far have fallen short. This is reflected in the enormous vaccination gap between higher income countries, where vaccination has been completed for 50 to 60% of the population, while in other lower income areas, as I said before, is less than 5%. So I think we should really try hard, because if nobody can be safe unless everybody's safe. Yeah. And although the multilateral initiatives such as COVAX and individual governments invest billions to expand production plants, manufacturing capacity is far below what is needed. Only about a dozen countries have the capacity to produce COVID-19 vaccines. Production capacity is a key barrier for vaccine availability. This is why we need more global cooperation to establish new production sites for COVID-19 vaccines and equipment, and of course, to increase the contribution to the COVAX initiative, which should be more ambitious.